and not this kind of love that you want kind to possess them. This is not love. This is possession. And people need to differentiate. Love and compassion is this, I want all the best for you. Even if you leave me, and I really want everything for you. And this is compassion. This is compassion, love without possession, without attachment.
Suicide is such a nuanced, and there are so many varied reasons as to why some people might take that option. But for a lot of people, we hear that it's a way out of the pain, it's a way to cope with the pain. But then MBIs kind of helps increase your ability to regulate yourself and to deal with those big emotions.
And John Kabat-Zinn makes a joke. Are you in the shower? Maybe you have 10 people in the shower with you. Meaning in your mind, maybe you are having a conversation with many of people. Are you really in the shower, or you kind of having your meeting now? So being in the shower meaning being attending the sensation of the water on your skin. Is it warm? Is it cold? How it feels? Being in the shower, not being in your mind, who is somewhere else maybe in your meeting.
Welcome to the Mental Wellbeing Show, where we take a deep dive into the wonderful worlds of psychology and mental wellbeing.
Hello, everyone, and welcome to today's episode of the Mental Wellbeing Show. I am Indy Disanaika, host of the Mental Wellbeing Show and provisional psychologist. In today's episode, we discuss all things mindfulness-based treatments and compassion with Dr. Bassam Khoury. Bassam is an associate professor in the Department of Educational and Counselling Psychology at McGill University. Bassam directs the McGill Mindfulness Research Lab, and his work on mindfulness and compassion has been cited over 5,000 times. So it's safe to say he is a subject expert on the topics that we cover today. Speaking of, we look at some of Bassam's work on how mindfulness is now being used to treat a range of mental illnesses and conditions, including suicidal ideation, how we can use practical strategies to implement and improve our own mindfulness that go beyond just sitting for hours and meditating, and why compassion may be the antidote to perfectionism in Western society, as well as much, much more. Now to today's episode with Dr. Bassam Khoury.
Bassam Khoury, welcome to the Mental Wellbeing Show.
Thanks, Indy. I'm so happy to be with you today.
Yeah, it's great to have you on. It's a conversation I've been looking forward to for some time now. The more I look into various topics within psychology, the more mindfulness seems to pop up as a treatment with more and more evidence behind it. So from a clinician's perspective, it's one that I'm beginning to appreciate more and more of. So to be able to dive into it deeply with an expert like yourself is a great opportunity. But I thought today we could start by just defining what we mean by mindfulness.
Yeah, I think that's an important question and a complex one. Most people kind go and think there is a single kind easy definition of mindfulness. If you look at multiple definitions of mindfulness, you see that there is no consensus on one definition. But we have to understand first that mindfulness comes from Eastern Buddhist traditions. So it wasn't created in the West. It was important to the West from a Buddhist more kind of philosophical background. So mindfulness within Buddhism is part of many ethics that aim to diminish suffering, not only to be less stressed or to be happier, but to have less suffering and to be a better person. Now, in the West, if I go a bit about definitions, most definitions focus in the West about mindfulness as a way to pay attention, like pay or direct attention to intentionally in a way that you do that intentionally to be aware of what's happening inside you and maybe outside you, depending where you direct your attention. And some might include things like acceptance, accepting of whatever is happening inside you, meaning acceptance of emotions, thoughts, sensations, things that are arising in the moment, not fighting them, not judging them, not trying to change them. So that's if we go to academic, more kind of definitions. Our work on mindfulness in my lab focused a lot on the embodiment part of mindfulness. So how we can anchor mindfulness within the body, and focusing about how we can detach from thinking, for example, and directing attention and awareness to the physical sensations of the body. So to be kind connected to the physical body, to be present and connected, and then to accept whatever is arising within your body, whatever the sensations or emotions or feelings. So these are kind of maybe most depending of type of definition within the West. But I think again sometimes we lose a part that is more related to global ethics within Buddhism, that is beyond mindfulness, is beyond the practice itself. But the intention is becoming a better person, and escaping or overcoming, or transcending, if we say maybe the more precise way, transcending suffering.
And obviously, mindfulness, coming from those Eastern traditions, like you said, is now more and more looked at from a Western kind of science point of view, and it's culminated in a lot of these MBIs or mindfulness-based interventions. I know that they're varied and there are multiple different MBIs, but can you kind of talk us through a little bit about what some of the essence or the commonalities in these MBIs are for people who might not be familiar with the concept of mindfulness-based interventions?
Yes, that's very good. And certainly that's maybe the most part that is burgeoning within the West, what you mentioned as MBRs or mindfulness-based interventions. So it can be that we can call them sometimes interventions, sometimes programs, sometimes therapies, depending of the angle you are using. Because intervention means something clinical. You are intervening to change a condition. Now, a program maybe it's a bit more inclusive because you can have a program for someone who is not needing intervention, but maybe they can benefit from it. So sometimes because they're programs, sometimes intervention, sometimes therapies. Therapies also, it seems like there's something to work on. But depending on how people use these terms, the main idea it came to integrate these elements of mindfulness in kind of a package. So intervention, program, or therapy is a package. In a way, it's a number of sessions that that are kind of conducted within a protocol. A protocol is like you have session one, you do this type of thing. Session two, you do this type of thing. Session three, most of these MBRs, majority of them are within 8 sessions. And most of them are within 1 hour to 3 hours per session. So they can vary. Some of them are shorter. Like you can have a session of 50 minutes or 45 minutes or 1 hour. And some of them are as long as 2 hours and a half or 3 hours. Again, most of them are 8 sessions. Some of them are shorter, can be two or three. Some of them can be 12 or more, but the majority goes within 8 sessions. So that's how these MBRs have been structured since the 70s. It started by John Kabat-Zinn, who is MIT scientist and was interested actually in mindfulness and meditation specifically. So integrated these elements of mindfulness in a program called mindfulness-based stress reduction. So the aim of the program was to reduce stress. And he tried to do it that mostly it was patients who had some chronic conditions, back pain, can have conditions as even cancer or other chronic conditions, and trying to see if it reduces their stress. So most of these programs started by working on these elements. Now, what is common on them, as I said, is the structure. Most of them are structured that way: sessions, and meditation. Most of them, almost all of them, have meditation each session. Now, meditation can vary between 10 minutes and 45 minutes each session, but most of them will include some sitting meditation, maybe walking meditation, eating meditation. Most of them might include some yoga, but not. We are not talking about heavy yoga, more stretching yoga. Some of them might include some psychoeducation, group discussions, other practices related to the themes of mindfulness, like detachment of thinking. So you might have some practice how you detach from those thinking, for example, how you can be more aware of your physical body, but body sensations. So that's how they are structured, majority of them. Mm, And if you look now at the populations, it's so violent. Like you have, yeah, they have been used with people with chronic stress or chronic pain. They have been used with people having conditions like cancer, physical conditions, psychological conditions like anxiety, depression, psychosis, borderline personality disorder, all kind of psychological conditions have been used with different ages. You see some in schools as young as like 6 years old kids and as old as 90 years old older adults. So there is a range of populations, clinical conditions, non-clinical populations, uh, and being targeted with what we call MBIs.
That gives a lot of insight into, I think, to what the crux of MBIs are. And I want to dive into what some of those conditions that MBIs are more effective for as far as the research goes. But you mentioned cancer a couple of times. So excuse my ignorance, but is this in terms of treating cancer-related outcomes like fatigue, or is this in terms of treating like the cancer itself, the underlying cancer?
That's an excellent question, and thanks for pointing that so we don't induce people with kind of misinformation. No, certainly it's not a treatment for cancer, MBIs or meditation or any other type of practices do not treat cancer in terms of the tumor itself. We don't. Nobody should claim that. I don't have any evidence of that. But cancer comes with as many people, specifically if some people have relatives who have been suffered from cancer. They know it comes with stress, as we mentioned, fatigue, anxiety, depression, uh, loss of meaning. It comes with a package of emotional, psychological, and physical toll beyond the tumor itself. It comes with all these and MBIs and other kind of protocols try to kind of reduce these, and they have been shown effective in reducing against stress, anxiety, depression, and other maybe related elements to cancer. Now, I'm not aware at all if there is any impact again on the cancer. It's a via reduction of stress. Again, someone might say, okay, there's some indirect impact. It might be, but I cannot state that. I didn't see studies talking about cancer itself being changed or in any how, but we can say at least the quality of life is better, and maybe indirectly it might. I would say it might was a larger kind of question that it might have indirect impact in terms of success of the medical treatment of cancer.
Well, you alluded to it there, Bassam, in terms of what conditions MBIs are more useful for. You mentioned a few things in the cancer space, cancer-related outcomes like the stress and the anxieties that might be associated with it. But generally speaking, what does the evidence say in terms of conditions and disorders that MBIs are more effective for?
That's also an excellent question because again, there's a lot and many articles today in that talk about this hype towards mindfulness, and it's important also as scientists, as researchers, as clinicians also to be aware of what it is helpful, where it might not be effective, what are the limitations, so we don't kind go blindly about it. Now, if I look at evidence specifically in large kind meta-analysis we have conducted in our lab and colleagues have conducted, we have seen, and I will tell you from my own research and from reviewing research in the field where we see the most effectiveness so far, I would tell you stress, anxiety, depression and maybe stress anxiety even is higher on the scale because again they had targeted stress at the beginning and MBSR, which is mindfulness-based stress reduction, is among the most used internationally today as MBR. There are other MBRs, there are plenty, but MBSR is the most known one internationally. So and MBSR, the first target is stress. So it's not surprising that we see stress being the first variable that have been shown in most of these studies, in a majority, have been impacted positively, meaning reducing stress following an MBSR. Then anxiety, which is second related to stress. Then we see depression in many of these MBIs, specifically mindfulness-based cognitive therapy, which is a combination of mindfulness and CBT, which is cognitive behavior therapy. So mindfulness-based cognitive therapy have been shown to have impact on depression, for example, or recurrent depression. Like people have been depressed many times. So these are the conditions that we have seen the most impact. Now we see also impact on things like psychosis. Doesn't mean psychosis meaning the positive symptoms of psychosis. Also, like meaning hallucinations or delusions, but we see impact on what we call more the negative symptoms, also emotional symptoms, meaning again stress, anxiety, depression. We can see on the quality of life. We can see on social interactions or on emotional regulation. So we can see these other variables that are related to psychosis, even though they are not the main focus of the positive symptoms, which are normally delusions and hallucinations. So we can see in multiple conditions, but again, most of the variables we go again into clinical variable will be stress, anxiety, depression, and some what we call non-clinical would be quality of life, well-being, satisfaction in life, maybe emotional regulation being a big one, which is extremely important. So that's where we are in terms of research today, what we know.
Yeah, okay. And so stress, anxiety, depression, there's obviously a number of treatments for these conditions, if you like, things like CBT, MBIs, ACT, acceptance and commitment therapy. So I've been trying to kind of like get in my head a picture of where MBIs lie. Are they like a first line treatment for anxiety disorders, for, clinical distress, for depression? Or under what kind of circumstances would you say that MBIs are better than, say, CBT? Because going through the research, I struggled to find like trials where they were like kind of compared head to head. Is there something that I'm missing there, or?
That's an excellent question. So let's go a bit to history of what we call these are therapies, starting by CBTs, because again that's where things started. And CBTs started first by what we call behavior therapy, BT. They were not C even at the beginning. So the first wave, what we call it, in cognitive behavior therapy, was mainly behavior therapy. And behavior therapy targets changing in behaviors, as it's called. It's called behavior therapy. So it will target changes in behaviors. Like if we go to the first wave of behavior therapies for anxiety, so we ask you, for example, to be present with the object of your anxiety. If you are anxious about people socially, they ask you, you need to go and engage with other people socially and be with this anxiety. So exposure. You expose yourself to the object of you are afraid of until it diminishes impact. So that's the first wave of um, CBTs, and certainly have been shown a lot of effectiveness. However, there's a big however, people are very reluctant. If you do it, if you expose yourself to every little thing that you are anxious about, most likely it reduces anxiety a lot. And in terms of depression, they ask you to activate. Go do some physical activities, do social activities, activate yourself cognitively, socially, physically. Excellent. If you are starting to have depressive symptoms, now again the other question: how many people would want to do that, or would accept to do that, or would engage in? And then what it becomes difficult. So the idea by itself can be effective. Now clinically, because you have to translate it clinically, if people are not doing it, okay, what you cannot do? I mean, there are limitations. You cannot do it for them. Yeah, they have to do it. And that's where I think behavior therapists will struggle because people not always are game to expose themselves to something they're extremely afraid of, or to do all these activation when they are extremely depressed. They don't want to get out of bed. And the second thing is that they have been kind of criticized for, it invalidates the emotions. Because let's say if I'm extremely a BT behavior therapist, somebody tells me I'm feeling sad, I'm not happy, I'm that. I might listen if I'm nice, but most likely I'm almost ignoring that and saying, you have to do this, do that, change this, behave that way, change your behavior. You would change how you feel. But many, specifically when you have these emotion regulation issues, and people might not only might feel, they will feel invalidated and might create a lot of negative reactions, meaning people abandon and people saying the therapist, I don't like them. I don't. They make me feel even worse because they kind of asking me to do things, and I'm not. I don't want to do these things. So that's where a lot of pushback will become. And if you have these kind of, like say, borderline personality disorder or something like this, more emotional dysregulation, people will extremely be not at ease with that, and most likely they will abandon the first session. So again, these are limitations. From there, they come the CBT. So they added the C after the first wave, which was behavior based. They added the cognition, which kind of wanted a bit to augment the idea of CBTs. And then they added cognition, meaning you can work on how you think now, not only on your behavior, which is important, stayed important, but how you think about, for example, being afraid of seeing people or talking to people or interacting. So they can't try to appraise or change the way you think about it, your belief system. What they called also kind of cognitive distortions. You believe about yourself or others or the planet or the world. So they try kind of say, okay, these are distortions of the way you're thinking, and maybe there are better way or more adaptive way to think. So this was a lot of cognition now. And some therapists went also CT, like cognitive therapy, and said, okay, behavior, let's forget it, let's focus, it's all about thinking. It's also a bit exaggeration. Again, I mean, there are benefits of working on these distortions, cognitive restructuring, meaning changing the way you're thinking, trying kind to appraise your source, labeling these kind of distortions and working on changing them. There are benefits, no wonder, but there are limitations. Because people might kind of do this work, but secondly, it requires a lot of effort because now you have to write your source. I think like that. I need to find where is the distortion. I need to write it differently. So there is a lot of engagement in terms of homework. There's a lot of assignments, homework. Second, thoughts are very fuzzy. So you might kind of place the way of thinking on, but then it comes differently. So it's like it will catch you up. It's not that easy. It seems easy and it might be effective, but on longer term, it might be less than because if you change one thought to another thought, then it comes in a different form and shape. It is not as simple as someone might think. And not everything is also based on thinking. Certainly, thinking is part of the process. But let's say if I had a trauma or emotional experience that is extremely negative, I have hard time regulating my emotions. I'm not able to go to these cognitions and appraising and writing my thoughts. I'm like flooded with negative emotions suddenly in a state of crisis. If I tell you, okay, uh, calm down, go and write your thoughts and see what are these distortions, try to kind change them, structure them. It might be kind, I'm talking in other language. Again, many people will feel invalidated, will feel that you are kind of invalidating their emotions, they don't feel understood, and they tell me, I cannot do it. I mean, what the hell? I cannot really do these kind of things when I'm flooded with negative emotions, when I just, something triggered me and I want to react. So there are a lot of limitations. Then also CBT come to a bit include more and more emotions because they said they've seen that you cannot ignore emotion. We cannot only work on cognitions and behavior. People need to be validated emotionally. So there's some work and some therapists from CBT they included emotion focused therapy or other modalities kind of to attend some of these emotions. So that's what happened. Like first generation, second generation, then comes what you called from the beginning MBIs. This is the third generation. So it's not like a different branch. It's within the CBT. From BT, CBT, then M, MBRs or MBCT or MBSR, they come as a third generation. So they have behaviors in them. They have cognition depending a bit different than CBT. They have emotions, extremely important, and so body. And now a way most most of the time mindfulness and these practices of mindfulness to be able to handle that, to give a space to handle that. So the new generation was not like saying what was done was totally wrong. We should like just forget about this. Is very different. It's within the same kind of approaches, but said we can tackle that a bit differently. For example, in terms of thinking, the big difference between MBIs and CBT, traditional CBT, they said maybe we should not so much focus on the content of the thought, whether it's adaptive or not adaptive, whether it's a distortion or not a distortion, but just to detach from it. Let's just take a step back. And this can be done through meditation, ACT, for example, which is some people call it as a generation, CBT also ACT, which is some people might call it even mindfulness based. It's not, it has mindfulness in it, it's not as MBIs, but some people call it within MBIs. So it has some element of MBIs. In acceptance and commitment therapy, ACT, they tell you also detach from thinking. There's this detachment, decentering, or diffusion, called diffusion. But it's the same. You can call it detachment, decentering, diffusion. The idea is that let go of the source. Don't try to say it's good or bad, adaptive, non-adaptive. Don't call it distortion. Don't call it plurality or effect. Just detach from. So that's the change that MBIs and ACT also included in a way that you can kind step back from thinking versus like engage and trying to change thinking. And there's a more emphasis on the body, on sensations, which was a bit less present, or much less present in CBT, and being present was that accepting, as in ACT, but also MBS include acceptance in another way, even if they don't call it within the title of the intervention, but certainly this acceptance of feelings, sensations, thoughts, everything happening inside and outside. So ACT and MBS are not 100% different, but just ACT doesn't ask the participant or patient or client, whatever you want to call, to necessarily meditate. They tell you okay, they can do it without meditation, but the principles are the same, almost principles within MBRs, but sometimes the approach or practices are different. Now you have there's a second part of the question which is extremely important. What are comparison? Who is more effective? We have all these behavior therapy, CBT, ACT, MBRs, and there's DBT, didactic behavior therapy, and there are many others. This is an important but complex question. There is no indication that one is 100% superior. And I will tell you from evidence, even though certainly, and I can be frank, I'm biased, I'm more MBI based. I'm more towards that at my work. But when I investigated that, it has been 10 years now, but I don't think evidence changes that much. We investigated that in a big meta analysis in 2013 with 200, over than 200 studies. When I compared CBTs, let's say, to MBIs, evidence didn't show difference. Or evidence were inconclusive. I couldn't say that this is better or this is not better. It's just like one trial, so this is better, the other one shows the opposite. So at the end, you cannot make a conclusion. So my conclusion comes, I don't think one is necessarily better or superior. I think depending of the people. Again, depending of the participant or patient or client, whatever you call them, depending what works for them better. Some people are very cognitive and they would love CBT. They love something very kind, structured, extremely assignment based. It requires more thinking than maybe going into these feelings and body sensations. Uh, and some people would be extremely invalidating for them and will benefit much more from mindfulness based. I think it depends of the individual. That's my clinical practice also. I see that some people will not respond to this, even if you want them to respond. But there are reasons. Some of them we understand. Many of them we do not understand scientifically. But they would respond to one modality versus another modality. So I don't think so far. That's what my impression. We can say this is more superior than this, or this is better, and this is solve all the problems. I think it depends of who you are working with and what they want. And you cannot impose. You should never impose any modality on anyone if they don't want it, if they are not interested in, or they don't like it, or they don't believe in it. Because from the face validity, it won't be effective. If I'm telling you I don't believe in that, it's done. You lose at the beginning.
It reminds me of a conversation I had recently with Dr. Llewellyn Van Zyl. He's an organizational psychologist, and he referred to the importance of efficacy beliefs, that what your client believes to be effective is going to impact a lot on the treatment outcomes itself. And you have to be able to kind of move with them depending on what their initial beliefs are. So if someone doesn't believe that MBIs are going to work and is adamant that it's not going to work for me, well, then you have to shift with them, right?
Totally true. If somebody tells me I do not want to meditate, this is not for me. I mean, I believe in meditation. I practice it myself, but again, I cannot impose it on somebody else.
Yeah. No, it's very interesting. I must have missed that meta-analysis comparing MBIs and CBT, but that's interesting to hear that there was no significant difference across a range of conditions. Yeah. But one of your other meta-analyses that I was really fascinated by was the meta-analysis looking at the utility of MBIs for suicide or suicidal ideation. And I want to be clear in my wording, so feel free to correct me if I am not doing your findings justice. But it seems as though you found at least preliminary evidence supporting the use of MBIs for suicidal ideation in some cases based on your meta-analysis.
Yes, that's true. That's a meta-analysis that few of my students engaged in, and I was supervising them. So we try to focus on suicide. Actually, that's our target: suicide and mindfulness, or MBIs specifically, and suicide. But certainly, it's much harder to kind evaluate suicide as meaning people who completed suicide or that, because it's not reported across studies. It's much more complicated variable. So we focus on suicidal ideation, which is much more common actually. People might think only like 5% of people have suicidal ideation. Some studies show up to 50% will have at moments some suicidal ideation. So it's much more common than let's say an act of suicide or more planning suicide or intent of. And yes, we find that again, MPIs had positive impact. And we think that this comes with kind acceptance. Most of that comes not from a vacuum. It's acceptance of what's going on inside. Because some of the suicide ideation will come, I cannot take it anymore. It's too painful. So the best way is to escape. If I'm able to accept suffering and accept pain as it is, my suicide ideation will diminish. Even though it's my condition that didn't change, let's say. Whatever is there is there. But if I'm able to deal with it, very likely, uh, my suicidal thoughts will diminish.
Is that like because for a lot of people, and again, suicide is such a nuanced, and there are so many varied reasons as to why some people might take that option. But for a lot of people, we hear that it's a way out of the pain, it's a way to cope with the pain. But then MBIs kind of helps increase your ability to regulate yourself and to deal with those big emotions. Is that kind of one of the hypothesized mechanisms, you reckon?
Totally true. Suicide comes about again. Not there is no one like by default wants to die as a kind wanting to die or do not want to live, but there is suffering in life, there's pain. And that's true. And it's a fact we cannot ignore pain in life. So and if pain become in a level that is not anymore tolerable, it's too hard to handle. It's almost normal to think of suicide. So MBIs do help, especially mindfulness practice, in terms of being able to be with that pain. Again, without even changing the pain, but just being able to be with it. And we know from the fact, even physical pain, and there are studies on physical pain, if you are able to attend physical pain, let's say you have a knee pain, or a back pain, or a hip pain, or headache, if you are able to be with it without judging, without reacting to it, without getting annoyed, angry at it, it won't change the pain, but it will change the perception of pain. You'll feel less in pain suddenly. Does not mean it's really you don't have any more migraine or don't have any more knee pain or hip pain or back pain, but suddenly because of accepting of these sensations that you don't want to have them. Nobody wants to have pain. Pain become more acceptable. And the same of emotional pain or psychological suffering. If you are able to be with it, it diminishes. So it's what we call degradation, as you mentioned. What is degradation? Is being able to use until it degrades. It's less unacceptable, less intolerable, less extremely severe that you cannot contain. So it's regulated in a way. It's not absent. It's not it didn't disappear, but it is you can be worse, and that's objective. And sometimes again people think it's like a magic. There's no magic in it. It's just being worse. It doesn't change the condition. Necessarily, it changes your reaction or perception of the condition. Same as cancer. We're talking about cancer. It doesn't necessarily change the cancer, but change your reaction to the cancer, to the situation, to the condition.
I think that's so important because I feel like I myself am losing the ability to contact and accept difficult and negative emotions. Like in today's society, it's so easy to just distract myself, to pick up my phone, to check social media, to check emails as a distraction mindlessly when I have a negative emotion, rather than actually like confronting that and dealing with that, head on. And it's something that I observe broadly on a societal level, that it's so easy to numb our pain now, whether that's with external things, drugs, alcohol, or whether that's more subliminally, like for me, like I said, with, just checking your phone or your social media when you get these, negative thoughts or, negative emotions just pop up. Whereas it seems like mindfulness really teaches us to actually accept and contact those emotions.
Yeah, exactly. I totally agree that there is kind of a risk of the because of the existence of ways to escape pain. That I mean, always we had ways. I think now there's more ways beyond what is obvious, as you mentioned, drugs, alcohol, substances, which have been around since a long time. But now we have subtle things that seems not that harmful, like social media, your Facebook, your YouTube, your Instagram, TikTok, then videos and uh, porn many are using. So all these distractions, all these ways to escape pains that seem not harmful. You don't need to go too much spend money or put yourself in danger because they seem they are very accessible. Everyone has a phone, so it's so accessible. But unfortunately, they are harmful, especially if they are used always to escape internal situation or external situation because it teaches the brain and teaches the person that you need always to escape that. But the problem there is no escape at some point. So you can use all these, but at some point there will be a crisis. Maybe it will show in suicide, maybe it will show in severe depression or something else, but there will be a crisis time because it's impossible. It's to always escape pain. So other way is to be with it, just to be with it. As simple as that. It's simple. It's not easy. But it's simple.
Yeah, and it's such an important point. It really is. And so I want to change tack a little bit and ask you, from your experience as a clinical psychologist, as a mindfulness researcher and an expert in the field, what do you say to people who still think that mindfulness is a kind of a woo-woo subject or a pseudoscience? Because, I'm sure you've had to confront that yourself, and I know those beliefs are still out there from some people. So what would you say to those who still hold those beliefs?
Yeah, that has been tough. I have been around since a bit the beginning of the wave. I would not say in the 70s. I wasn't around, but I mean in the last maybe a couple of decades, when mindfulness was more taking importance and recognition and in scientific community. And I remember not very long time ago, if I go back in memory, maybe 10 years or so, or maybe a bit more, that I was in a conference about meditation and mindfulness and how we bridge that to science. And and there have been some workshops for researchers who are applying for funding. And and we have been there have been recommendation at that moment. Today, I hope not, and I don't think it is the case. But there will be a recommendation at that moment, not always to use the word meditation, and trying to go around it by some kind of attention awareness, direction of attention, because they said that some granting agencies, and we're talking about big granting agencies, might be allergic to the term. So it hasn't been long time that even using that word in a funding application for a grant, which is extremely important for research, would play against you, might play against you, because some of these reviewers or decision makers will look at it and say, as you might say, pseudoscience is not important, not valuable, coming from something we don't know, from these Eastern kind of traditions, so we don't like that. There's a lot of that. Now, it doesn't mean it today ended. I think it shifted a bit because there's much more ground we are standing on. There's thousands and hundreds of thousands of scientific papers, but some of these attitudes are still there. Maybe a bit less explicit because they know it's not as easy defendable that we can reply, but implicitly, I still see that within scientific community, outside the scientific community, there are still this kind of othering, I think. And I don't think it's about only because it's mindfulness. Because I mean, any new wave, some people might feel unease because it changes things. But I think because, and I maybe I don't like to say that, but because I think it's associated with an Eastern and non-Western practices, it makes some people at least a part of the society, and while aware of that, unease with that because they feel or they have the impression that it's not very Western idea. It's like coming from somewhere that is not Western. And if I put it more into words, it's not also so much God based, meaning within the religious practices within the West. This is like a bit foreign. And some might perceive it as a threat, actually, to some of what they perceive as some conservative values within the West. So these practices might be a threat for them. So I think there are these attitudes there. I mean, my reply is again, we need to go to science. It's not just a preference. Science is more and more solid, and it's not only subjective measures or objective measures, are brain measures. I don't do this type of research. I wish, but it's not my area of expertise. I'm of brain research, but there's a lot of brain research than clinical research and social research, and all are coming together to fundamentally show the scientific value of these practices. And I'm not talking about the concept of mindfulness. The concept is a concept. We can all argue about it, but the practices of meditation, the practices, we can maybe talk about compassion, these practices and their impact on individual and society. So I'm not afraid of that, but I know it coming from fear, being afraid of this new thing or this other thing or this non-Western thing coming to us and changing something within the society. And so it's perceived as a threat. And it might stay perceived as that and might not be able to change it.
Yeah, even just anecdotally, my own opinions of mindfulness have changed over time, and I'm certainly more and more accepting of it as a really potentially a really effective practice for some people, with mental illnesses and just subclinical issues. Because like you said, there are tens of thousands of papers now, and it's unrefutable that there is evidence for this. But in terms of my own practice, where I'm at now, just to share, Bassam, I struggle, but I'm somewhat consistent with doing like a 10-minute sitting meditation every day at the moment. I've never partaken or as a clinician administered an MBI myself, but I want to ask, how can I and others listening improve our mindfulness on a day-to-day basis without partaking in a formal MBI or having to sit down and engage in sitting meditation for hours upon end?
Okay. That's a good question. And I get it a lot in workshops I give on mindfulness and how is the practice and the challenges of the practice. And I think it's extremely important to talk about this. So in terms of practicing, now we're going from the concept to the most important is a practice, because the concept is a concept. If you don't practice, there is nothing. So the practices, there are two section of practices, or two types of practices, we can call them. Some of them are formal practices, and some of them are informal. What that means? Formal is that you put time to practice. You are doing it as a specific activity. Informal meaning you are integrating it with other activities. Let's go to the former one first. So former, you are putting time to the practice. It's the same idea of going to the gym. So you are not just trying to do some steps when you are going to school, but you're going to the gym to practice some of your muscles, or all your muscles, whatever you choose. Now, so in the former, you want to practice mindfulness. You want to practice some of these skills, because mindfulness is again a concept. You want to practice, for example, attention, or awareness, or direction of attention, or focusing attention, what we call shamatha. Focus. You want to focus your attention, or you want to open your attention to sensations, emotions, uh, thoughts, whatever happening inside you, outside you, what we call vipassana practice. Or you want to work on your compassion and love and kindness, what we call loving kindness meditation, compassion meditation, metta. So again, within the format, there are multiple practices. What I'm saying, there are focused attention, open awareness, metta, other practices that you can engage in. And now, in terms of duration, you can engage in few minutes, you can engage hours, and that depends on you. But again, there's a duration, and you should not be stringent or rigid in that. If you feel that you cannot stay for 20 minutes, stay for 5 minutes, okay. Start by something that is less, but try to be there. It's not important to say, I want to do 20 minutes. It's not a competition. It's not a winning time. It's not you are competing against someone. Just try to be there, whatever it's few minutes. And the choose, again, there's plenty of choices within the formal practices. There's body scan. There are multiple practices. Choose which one would work more for you. Which one will have more appealing or more ease inside you. Yes, in terms of maybe Buddhist trainings, they would recommend you starting by what we call again shamatha, or focused attention. So you develop this ability of focusing your attention, then you can open it in open monitoring of vipassana. But again, if it's difficult for you, do something. It's okay to try one of these multiple practices in a way you can engage in. It's important that when you are doing that, and I'm taking some of the recommendation from John Kabat-Zinn, the father of mindfulness in the West, that you have to do it in attitude of love, of acceptance, of non-judgment, of wanting to do it, not I have to do this thing. Uh, I I really don't like to say the message as you have to do mindfulness, you have to do meditation. I really want to be with myself. It's a gift I'm giving to myself. It's a time I'm being with myself. It's a nice thing you're doing to yourself. It's not something you should do. You are not doing actually. You are just being. There's no doing. There's no doing at all. It's being. You go to the gym, you do. You meditate, you be. You don't do. You be. So there's difference in that. So that's the formal practices, and there's also informal practices. Meaning, let's say you are walking. You are just walking, and you just try to be aware of your foot, of the sensation of shifting your weight from the left foot to right foot. You'll be aware of sensations outside you, trees, the animals, sounds, the sensation of the sun on your skin, or cold air on your skin, or if it's raining. So you are aware of sensations of your body, of your surrounding. So that's what we call informal practice. You are eating, all of us eat, but most of us eat in front of the TV or phone or something else, distraction. But can you be aware of the smell, the taste, the texture of the food, how it feels when you are eating, what's happening inside your body? So this awareness. You're taking a shower, and John Kabat-Zinn makes a joke. Are you in the shower? Maybe you have 10 people in the shower with you. Meaning in your mind, maybe you are having a conversation with many of people. Are you really in the shower, or you kind of having your meeting now? So being in the shower meaning being attending the sensation of the water on your skin. Is it warm? Is it cold? How it feels? Being in the shower, not being in your mind, who is somewhere else maybe in your meeting, or planning the future, or your trip, or whatever you have to do on the weekend. So these are what we call informal practices. They are important, but so you can integrate them throughout the day. And there's the other branch also between the formal and informal, or what's called movement based. So people do yoga. So there is mindfulness in yoga, depending how you do it now. You can be mindless in yoga, but it helps you if you do it with as a presence to be mindful of your body, of this position you take, depending of the teacher you are doing. So yoga, tai chi, qigong, all these kind of martial arts or practices, they kind ask you to be in your body, to attend sensations, to attend your physical balance, all that. So these also are ways to be mindful. So there are multiple ways, and I just mentioned maybe just a few of them. There are more ways actually to practice mindfulness. So it's not one way. Sometimes people think it's I have to practice and stay all that time. It's not necessary. There are many ways, and MBIs are not for everyone. Some people like MBIs. Some people might find them even costly. So it's not the only way you have to go to an MBI. There are many ways, which is good. There's a lot of resources on the internet today, so many resources that are free. Some of them you have to pay, like apps, but there's a lot of information and resources and things you can learn in a way that it works for you. Again, at the end, it needs to work for you. What works for me might not work for you, and vice versa. What works for you, what has meaning for you, what it brings inside you. What really you want. And again, we talk specifically if we link it back to Buddhism, the intention. What you want. You want to be less stressed. You want to be a better person. You want to have better relationship. You want to be happier. You want to be calmer. What do you really want? And you have to ask yourself when you sit, meditate, or do something. What do I really want from that? What's my intention doing that? And start by this intention to kind of foster a motivation. What's my intention? Why am I doing it? And you need to ask this question because it's an important way to engage and to direct what you want from this practice.
I love that. That simple reframe as well of doing it. You have to do it versus doing it for yourself. Because, it certainly feels like a chore for me, my own, 10-minute daily meditative practice. So I think that's something I need to reflect on. Just that simple reframe. So that sounds very empowering, Bassam. So yeah, thank you for sharing that.
Hello, everyone. Just a super quick break from my discussion with Bassam to ask for a small favor. If any of the episodes have brought you value or brought value to your loved ones in your life, I would love it if you were to hit subscribe to the Mental Wellbeing Show. This is how I grow the show and continue to communicate mental wellbeing science out to the broader community. The aim of this show really is to communicate practical strategies in an evidence-based way by going straight to the source and the experts so that people on a broad scale can make real evidence-based changes in their own lives. And you subscribing really helps me do that. So thank you. And now back to today's discussion with Bassam.
I want to, as well, in the time that we have remaining, discuss your more recent work on compassion and self-compassion. And I think just like we did with kind of the more mindfulness part of the conversation, it would make sense to define what we mean by compassion and self-compassion. So yeah, what do you mean by those terms?
Yes, that's also extremely important, and there have been a lot of debate. Compassion again comes from Buddhism in terms of practice. Now we have to look at compassion in terms of, of the word or the idea or the concept and the practice. The practice comes within Buddhism, and actually Buddhism and many Buddhist teachers talk about compassion as the cousin of mindfulness. So it's so close, meaning, and you can see what it is a cousin. It's like a very close to mindfulness. So it's not something so much distant, or they should join from mindfulness. So it's extremely important part also of the ethical principle. When we talk about ethical principle in mindfulness in Buddhism, compassion would be one of these ethical principles, of these practices to elevate suffering. Again, because in Buddhism, the idea is to elevate suffering. It's not only like to do these practices just to be less stressed, but to elevate suffering. Now, in the West, there is a lot of debate. Now, when we go to the West, in terms of defining compassion, there have been as strong or even a bit stronger debate in terms of the definition. Now, what we include in it, what we don't include in it, there have been debate. I have been part of the debate, and I also wrote about the definitions. There are debates within the scientific community in terms of defining it, whether we put it as an emotion, for example, because compassion, if you look at the lit, at historically, it's very much a focus on this feeling of compassion. So there's a feeling, and there's a lot of evidence with this this feeling that is different than love, but it's close but different than love, what we call love. So there's this compassion that is a bit we try to kind of pinpoint to. And Kristen Neff, for example, she worked on compassion and defined it as this common humanity, kindness, and mindfulness, actually, which made a bit of controversial because she is kind of defining compassion. In her definition of compassion, she included mindfulness in it, as you need to be aware of your own suffering and suffering of others, which is not totally wrong, but it makes things a bit more confusing in terms of defining it. Now, what is the concept? How we define it? Because in the science, you want to define it to be able to measure it. If it's not defined, you cannot measure it. If you cannot measure it, now your research becoming a bit shaky. So Neff focused on this kind of kindness versus being harsh, being aware, mindful, or being identifying with suffering, and this common humanity, how you feel that your suffering is part of all humanity. And I think there's a lot of research showing that definition has merit. They've been criticized also because many researchers said actually it's not her definition is more about either being compassionate or not being compassionate. So having these kind of three elements are not always consistent in terms of research. Now in my lab we tried a bit to move the debate by saying let's focus on the practices again, because again theoretically we can say it includes this or it includes that. In terms of teaching, let's focus on the teaching. What we can teach people in terms of compassion, we can teach them how they can think about themselves and others. You can think in a harsh way, in a very judgmental way, or you can think in a more kind, open way, non-judgmental way, non-harsh way. So there's the thinking part. There's the feeling part, which is extremely important. You can feel that you hate yourself, and people told me in sessions, clinically, I hate myself. So you can have this self-loathing, hate, disgust, and I can tell you, I mean, people said even more than that. Or you can have love, kindness, as Neff would say, kindness, love, what Buddhists call warm-heartedness, soft-hearted. They use this kind of affirmation in describing compassion towards you and others. There's the behaving. Because again, if you are doing something like MBIs, but compassion-based interventions or therapies or programs, you want also to engage in people with how they can do. So there are behaviors that are more compassionate versus less compassionate. More compassionate, we think, let's say, you take care of yourself if you are suffering. Maybe you take a bath. Maybe you go for a walk. Maybe you have hot chocolate. I don't know, but you do behaviors that make you feel more soothed, more happy, more well. Or you go and hurt yourself if you are suffering, or you induce pain, for example. You self harm. I mean, and we work with population who self harm, or you try to kill yourself. I mean, you can go in different level in terms of behaviors, or you go and get yourself intoxicated, for example. So there are behaviors that can be compassionate, and behaviors can be punishment. Some people punish themselves, or others. Again, it works for you and others. And there's the interpersonal aspect. So we have the fourth element. The fourth is interpersonally, how much you are able to lean on others for yourself when you are suffering, to accept help from others. It seems obvious, but it's not obvious. Some people do not accept help from others. Versus saying, I don't want you when I'm suffering. I want to be separated, isolated from you. Also, in terms of suffering of others, how much you want to be with others. So some people do not want other people to help them, but also they don't want to help other people. When they hear someone, they call them, "I'm not feeling well." Okay, sorry, bye. So that's a non-compassionate answer. So you don't want to be with these people. You are kind of putting them away. So again, that's our definition in the lab, but I'm not saying it's the only definition, but because we focus on the practices. And the idea, again, the concept is a concept. Wherever you make it, the end point is a practice. Your end point you want to practice is what we call compassion or self-compassion. But again, self-compassion and compassion towards others is the same. We try to look at it as a parallel. What you do to yourself, what you do to others. It's not like separate. It's the same. There is kind of symmetry between you and others. Does that answer a bit your question in terms of the concept? Still, there is no definite conclusion in terms of agreement. Like everyone agrees on one definition, but we have to think what is the most useful definition, and then look at the practices because the most important is the practice. We can define it the whole day. We can talk about the concept, and scientifically we need because we need to measure it. But at the end, also we want to practice. We want people to do something that change that that thing that we call compassion.
It certainly does shed light on as to what compassion and self-compassion are. It also is another reminder that, like everything in psychology, there's just so much gray area, right? There's not much agreement on anything in psychology.
There's always disagreement
But
in psychology. That's what I was doing.
Yeah. So what are the benefits of being compassionate and self-compassionate? And this might seem like a really obvious question, but if I'm honest, it's something that even I'm struggling with at the moment, particularly being compassionate towards others, because I know that sometimes I just find it easier to just be in my own world, focus on my own goals and ego, if you like, rather than trying to display outwardly compassion towards others. I sometimes find that to be more effortful. So what are some of the benefits?
Now, in terms of looking at the benefits, uh, from those two concepts, self-compassion and compassion towards others, certainly there have been more research and studies on self-compassion than compassion towards others for multiple reasons. Because when Kristen Neff developed, I mean, she started on that journey of self-compassion. She developed self-compassion scale and measures way before anyone developed something towards compassion towards others. And the measures in compassion towards others started very recently. We had something that is validated. So there's not tons of studies, and I will comment on it a bit after, but there's not tons of studies on compassion towards others. There's much more, and a lot actually, significantly in terms of self-compassion. And if you look at what we know today from self-compassion, the studies before I talked at the end about compassion towards others, in self-compassion, what we see impact on stress, again, anxiety, depression, and how. For example, we see studies in linked with perfectionism, and perfectionism is burgeoning in the West. It's increasing. With people who think there's more and more this idea of being perfectionist or being perfect in all kind of dimension. And perfectionism, unfortunately, it's related to stress, anxiety, depression, and suicide at the severe cases, because this idea of pursuing the idea of perfection by itself is delusional. It doesn't work, and it's set to fail. So more you pursue that idea, it's an abstract idea because it doesn't exist. As you're pursuing something doesn't exist. So there's certainty in a way that at the end you'll be failing in this pursuit because it doesn't exist. So you'll be left with heightened stress because you're always trying to pursue something that doesn't exist and you're never satisfied. There's more depression because you don't have any more resources for yourself if you're pursuing some kind of perfection in any field, whether it's in science or arts or how you look like or how you sound like or your social interaction or your family or your home or your clothes, wherever you want. And many there's a body based also perfectionism in terms how you need to look, your muscles or whatever it is. At the end, you will hit the wall of being stressed, being without meaning, and finding there is no way out of it. So it's a dead end. And compassion, self-compassion work on the opposite line, accepting things as they are. And doesn't mean, again, when we say accepting things as they are, it's not like, okay, I don't put effort, I don't care. It's not about that. You do your best. And what it means for you, you try your best, but you don't attach importance to this objective, this kind of thing. And you don't put objectives of abstract as perfectionism. You put objectives that have meaning for you versus this abstract idea of perfectionism. So you shift a bit your priorities in terms of what's more important for you. So we see a lot of impact on that. We see also again impact on stress, on anxiety, on depression. They have been used in clinical population, like we can see older age people, we see young people, students, we see people with depression. Actually, there are studies with older people with depression. There are studies with younger people with depression. There's studies with cancer also patient again, and we see most of the time we see also again better adjustment to stress, anxiety, depression, higher well-being, quality of life, satisfaction with life. So there's global well-being, and we see well-being being an outcome of self-compassion. Now, compassion towards others, as I said in terms of research, it's still thin. But what we see in terms of in our lab, and we are measuring that, what we have seen in our studies, for example, compassion towards others was linked with better social connectedness, better relationship with others. So we think both can work. The self-compassion can work in diminishing with stress, anxiety, depression, let's say, and increasing your well-being, and the compassion towards others will help you to have better connection with others, which is another meaningful dimension. And and we think, and there are some evidence of things that somebody who really is compassionate towards others will feel better about even their own suffering. It radiates back to you feel better in the ways that you are giving something that is compassion towards others. So we have seen some of this impact, and both contributing, self-compassion and compassion towards others contributing to well-being globally. But again, so evidence on compassion towards others is still thin because it's new in terms of research in the West.
A lot of what you're saying there really resonates with what I observe societally and in my own self, particularly about self-compassion. I feel like the way particularly Western capitalist society, as much as it has, a myriad of benefits, obviously, but one of the drawbacks I feel like is that we're bombarded with messages of not being good enough, of being inadequate. You're not good enough until you buy the fast car, until you look like this, certain perfect quote unquote physique. Again, just not accepting who we are as of now, and striving for more always. And, we see this like with body image disorders, burgeoning rates of that, of cosmetic surgeries, this lack of acceptance of ourselves. And I've felt it myself. It's hard not to when, especially on social media these days, you're bombarded with that message.
Yeah, it's so very true. And certainly it increases people discuss. So we have to find ways to change that. There's a lot in the culture of this kind of attainment of things that are not only that are delusional in terms of this abstract perfection, but also that are not necessarily meaningful to the person. And that's, I think, the even deeper problem. If I'm working hard because it has deep meaning for me, this is okay. But if I'm working hard to attain something like a body image, but at the same time, it doesn't bring deep meaning. It's not only the method is bad, but also the objective doesn't have meaning. So we have double problem, and the outcome are not what we would have hoped for.
Yeah, and it feels like self-compassion is almost an antidote to this level of perfectionism and to meaningless pursuits. Is that if we're able to cultivate that more, we can almost heal ourselves. Just finally, Bassam, I wanted to ask, given that, self-compassion is so important, has so many benefits, and I myself personally know I need to cultivate more of this in our life, how do we go about cultivating more of self-compassion and indeed compassion towards others in our lives?
I will go first, with what it is been more known and what I think that it comes from Buddhist practices. And in Buddhism, compassion, self-compassion and compassion towards others, first, they are not separated. They are within the same kind of practices, and they are linked to practices of meditation or mindfulness. Again, so we are not like doing something on the side. And I think, and many of the Western, not all, but many of the Western programs that try to cultivate compassion use some of that. So in meditation, we were talking about meditation a bit in mindfulness. There is type of meditation called loving kindness meditation or compassion meditation, metta. So that's where you can meditate and kind to cultivate not only as the idea or against the concept, but the feeling of compassion. For example, some of these ways of cultivating it, you can bring in your mind. You are meditating and you are in a state of letting go, you are in a state of being present. You can bring in your mind, for example, an image of a person, place, animal. It can be a person you love, they love you. It can be a place like a forest, an ocean, a beach. It can be an animal you like, or any kind of creature. And you can bring how this person, place, or animal love you, how they want to hug you, how they are happy to see you, how much they want to give you this love, and you can feel it. Because again, we talk about cultivating it, so you need to feel it. You try to feel it in your heart, in your chest, and to stay with it. Stay kind, feeling this feeling inside you and resting with this feeling. Resting of feeling of compassion and safeness, being loved and then giving love to others. So it can be within the practice of meditation to kind of cultivate a feeling of this, what I mean, Buddhists call warm-heartedness. Actually, and we see, and there's a study that have been done actually in Germany, and they've seen that the temperature of the heart was raised after these practices. It's like warm-heartedness. It's not only a word, it's actually, it warms your heart when you practice that. That's being poured inside you because you are activating parts, and we have seen in brain study, it activates parts of the brain and has impact on the body because the body feels safe. When you have this feeling of compassion, you feel fuzzy and safe, and that's extremely powerful. Safe, you are not anymore in the state of anxiety or kind of looking for getting something because you feel everything's okay, everything is well, everything is okay. So there is a way to cultivate it. Now, if it's not meditative based, even though I'm extremely with the meditative based because it has the power of cultivating this deep state, is by doing specific actions, as we said, doing action of compassion towards you, towards others. When you are suffering, taking care of yourself, not judging yourself, not increasing your pain or punishing yourself, being kind, trying to kind of think in a way that is non-judgmental towards you and others, leaning on others when you need them, accepting help from others, giving help for others. So there are what we call again cognitive behavior, interpersonal, emotional strategies. But certainly, meditative strategies are very powerful in cultivating a deep state and knowing what is compassion. Because you can do these practices, there are things that are important, and I mean it's part of our measure of compassion. But also you need to know what it is deeply inside, and knowing requires a state of fully awareness, pure awareness. What can be in meditation allow you to this to really face the state of compassion and know what it is. Because if not, it stays a concept, and when it stays a concept, it doesn't have the same impact on you and others. If you don't know what it is in your heart, it fails to be compassion. So I try to people maybe try to feel it, try to go inside you, deep down, specifically if you really love someone and you want them to be safe, to be happy, to be free of suffering. Try to feel this feeling, what it means, and this is compassion. When you love someone so much and you want them to be happy, to flourish, to have the best thing in life, and not this kind of love that you want kind to possess them. This is not love. This is possession, and people need to differentiate. Love and compassion is this, I want all the best for you, even if you will leave me, and I really want everything for you, and this is compassion. This is compassion, love without possession, without attachment. This is pure love, and this is compassion. And if you know what is this feeling, you know what is compassion.
That's so profound and meaningful, Bassam. Thank you for sharing that. And yeah, it's resonating a lot with my own personal journey, and it's an ideal I want to strive towards. And you've certainly shared some practical ways in which I, and I'm sure many other listeners, can do that. So thank you for sharing that.
You're welcome. My pleasure.
Is there anything else that you want to share, or any kind of final pieces of wisdom that you want to impart upon our listeners today?
First, I thank you again for having this opportunity. I'm happy to talk to you and hopefully to listeners about mindfulness and compassion, things that I'm really, really deeply clear about. I would invite everyone and invite um, everyone within your listeners, within the scientific community also, to acknowledge also the roots of these practices and to have some kind of gratitude, so that we are you are inheriting wisdom coming from generations and coming from long, long traditions in Buddhism and Eastern practices. So it's not something that we build overnight. Even though sometimes we like to process things or to say we did that, but we really inherited a lot of things that allow us today to study these things and hopefully to share them with the world, but to share them with humbleness, to share them with kindness, with awareness, and to wish that people can benefit from that without a kind of that it doesn't belong to me, it doesn't belong to you, it doesn't belong uh, to whoever brought about that, it belongs to a long time of tradition, and we hope that we can share that, and people who really do these practices, they can share it with other people. So that's I think how we can carry this message. It's not about us, it's about these practices that elevate suffering. Um, and another thing I would like also to mention that in our compassion work, in mindfulness work, we focus a lot on humans, and it's extremely important. I am not diminishing that, but also we can extend it even beyond that. And we are working in the lab, and I invite people to also to think about all sentient beings that are suffering. Animals do suffer, maybe not the same way that because we suffer from our own thinking, but also animals have witnessed a lot of pain. Unfortunately, a lot of it was perpetrated by humans. I'm saying that not just to allow people to think about compassion for animals, that we need to really also understand their pain. And by understanding their pain, we can be kinder, more kind towards ourselves and them. And because they are our partners in this world, we don't live on this planet alone. Animals and nature are part, and we have to think about them also as they are our friends and partners on this planet. And if we want to have peace, we need to also include them in this peace. So that's maybe my message to everyone. It's for everyone. It's not only for me or you or even humans. It belongs to globally this planet and maybe beyond.
Oh, beautifully said, Bassam. And yeah, thank you for sharing that and for all your wisdom today that you've shared with myself and with listeners. I walk away feeling enthusiastic about how I can implement some of the practical things that you've said today in my own mindfulness practice and for my own well-being. And I've no doubt, I've got a few people in mind who I know will benefit greatly as well from what you've shared. So thank you for sharing that and for all your research on such an important topic to date.
You are welcome. My pleasure. Have a good day. Take care.
And that was Mindfulness-Based Treatments and Compassion with Dr. Bassam Khoury. that really was a beautiful discussion for me. We got to traverse, a number of topics, going from philosophy to religion to psychology, and it leaves me very excited to implement these strategies to now improve my own mindfulness. And it's been a journey for myself to try and improve this over a number of years, and to be able to implement what I think are really practical tips from Bassam is an exciting opportunity, which will hopefully be the change I need to make meditation and mindfulness practices a daily habit. I really would love to hear from you in terms of what your takeaways are and any value you gained. So please feel free to comment below with any of you, with any of your takeaways from my discussion with Bassam today. Stay tuned for next week's episode on sleep psychology with Hayley Meeklin, a sleep psychologist and researcher.